My name is Susan Anenberg. I'm an associate professor at the George Washington University Milken Institute School of Public Health. And it is my true pleasure to welcome you here today to be discussing health in the social cost of carbon. I just want to make a few introductory remarks. This event is co-sponsored by the George Washington University Climate and Health Institute, the GW Institute for International Economic Policy, and the GW Environmental and Occupational Health Department in the Milken Institute School of Public Health. The Milken Institute School of Public Health is celebrating its 25th anniversary this year, and it's the only school of public health in the nation's capital. The GW Climate and Health Institute is much more recent. It was chartered in May 2021, and the Institute envisions an evidence-based global response by governments and stakeholders to mitigate the climate crisis and equitably improve public health. It's a university-wide collaboration at GW that prioritizes cross-disciplinary research, training, and action to address challenges associated with climate change. And we've been holding these seminars approximately monthly to really bring a health and equity lens to various aspects of climate policy development, climate education, and other aspects of this very multidisciplinary public health challenge that we are dealing with. I want to thank my co-directors, some of whom are here today. And it's really a pleasure to be hosting this panel on the role of health in the social cost of carbon. This is a topic that is just so extremely important for the ability of the US government to bring down greenhouse gases, and is also a personal motivating factor for me dating back to my days as an employee at the US Environmental Protection Agency, helping to do cost benefit analysis for regulations. The social cost of carbon has somewhat of a long history, and it was recently revived with Executive Order 13990 in January of 2021. The social cost of carbon is the monetized damages associated with incremental increases or decreases, and the benefits of decreases in greenhouse gas emissions. And it's intended to include the value of all climate change impacts, including net agricultural productivity, human health effects, property damage, disruption of energy systems, and risk of conflict, as well as environmental migration and the value of ecosystem services. And you'll see that health is in this list, and yet health is still somewhat inadequately quantified in the models that are used to develop the social cost of carbon. And that's why it's so important to hear from these cutting edge researchers today who are really breaking down barriers to including health in the social cost of carbon. And before I hand it over to the panelists, I want to introduce Jay Shambaugh, who is the director of the GW Institute for International Economic Policy.
Thanks very much, Susan. So good afternoon or good evening or good morning, depending on where it is you're watching this, or for that matter, when you're watching this. My name is Jay Shambaugh. I'm the director of the Institute for International Economic Policy here at GW, or IIEP as we call it. We at IEP are very pleased to be co-hosting this event on health in the social cost of carbon, recent advances to fill a critical gap, and in particular, very happy to be working with Susan and her team at the Climate Health Institute. For those of you who don't know us, IEP is located at the Elliott School at GW and is a cross-school interdisciplinary research center at GW. We aim to serve as a catalyst for high-quality, multidisciplinary and nonpartisan research on policy issues surrounding economic globalization. That is a mandate we interpret rather broadly. And so it includes not just international trade or international finance or international development, but issues surrounding poverty studies, climate change, inequality, and economic policy more broadly. We also have a focus on policy issues surrounding China's economy or India's economy. We've been very busy at IEP over the last few years, and we posted a number of events that touch on climate in a variety of ways that people in this audience might find interesting. You can find links to the prior events at our website. There's a tab that kind of collects all the climate-related work in one place. Tomorrow, actually, we're hosting an event with former Congressman and former WTO appellate judge, Jim Bacchus, from 2 to 3, he'll be speaking about trade, but with a big focus on the impact of trade and the WTO on climate and on possibilities therein. So this audience may be interested in that event as well. It'll be streamed from 2 to 3, but in person as well. So I should also mention, if you're interested in any of the master's programs that relate to these topics, you can find more at the Elliott School website. So without further ado, I want to jump again back into today's topic. As Susan said, we're talking about the social cost of carbon, or SCC, or sometimes the social cost of greenhouse gases, or SCGHG, although that one rolls off the tongue a little more clumsily, at least for me. And so the SCC is supposed to be this cost, again, whether it's from damages from storms and floods, changes in agricultural productivity or labor productivity, or shifts in mortality, or all these other things of releasing an additional ton of carbon into the atmosphere. And at any point in time, it is intended to summarize the best of what scientific literature knows about these costs. And so there's so many factors involved, whether it's climate modeling, health modeling, economic modeling, valuing cost and benefits over different timeframes. It's obviously a fairly complicated process to figure out. And as Susan mentioned, we've had it for a while, but we haven't always had an SCC. And so it used to be that, in some sense, any agency issuing a regulation would have to be figuring these things out on their own. And the idea of the SCC was to say, no, let's actually collect all the best science and put it into one number, so we don't have every agency figuring this out along the way on their own. It's currently in the process of being updated. There's a cross-government working group on the topic. The National Academies of Science has put forward a report a few years ago scoping out different issues and places where it could be improved. But over the time since it was launched, I believe in 2010 or so, the SCC has been widely used. Many state agencies use their own SCC now. Actually, a number of large companies have created their own social cost of carbon that they use when they value their own projects. And so when the National Academies described this, they said these damages include, but are not limited to, market damages such as changes in net agricultural productivity, energy use, property damage, as well as non-market damages such as those to human health and to the services that natural ecosystems provide to society. And so this last piece, this, such as those to human health, is where we really want to focus today, as Susan said, in part because it is often argued that that is a section that really hasn't been embedded as much into the SCC, and a place where there really does need to be more work done to make sure it's truly reflecting what we know today. I'm really thrilled to hear from the scholars we have with us today to talk about this. We have a terrific group. First up will be Kevin Cromar. He is a program director of health, environment, and policy at the NYU Marin Institute, and is an associate professor of environmental medicine and population health at NYU's Grossman School of Medicine. His research program works on the intersection of scientific research and public policy in order to generate the knowledge needed to improve health and quality of life. Following Kevin, we'll have Noah Scovronick, who is an assistant professor of environmental health at the Rollins School of Public Health at Emory University. And his research focuses on understanding the links between human health, climate change, and climate policy. And then last, we'll have Tamma Carleton, who is an assistant professor of economics at the Bren School of Environmental Science and Management at the University of California, Santa Barbara. Her research combines economics with data sets and methodologies from remote sensing and data science and climate science to quantify how environmental change and economic development can shape one another. So we have a terrific group to talk about these things. They'll each present, and then we'll have some Q&A after. So I'll turn it over now to Kevin.
Jay, thank you so much. I appreciate the invite today, and I'm looking forward to the talks and the question and answer. Let me load my presentation here. All right, hopefully that's visible to everyone. Let me start by putting a finer point on what Susan and Jay already mentioned. Let me give you a timeline of the social cost of carbon as it's been used in US policy analysis. The first estimates from the Interagency Working Group were published in 2010. They were then updated in 2013, and there's a little bit more cohesion across the three integrative assessment models in 2013. We're still functionally using those same numbers today, They've just been updated in time. In January 2017, there was a very important report from the National Academies that came out. It recognized that the social cost of carbon estimates for the interagency working group helped put together were the best available, but there are some important improvements that need to be made both on the economic and on the scientific side. Unfortunately, a lot of those suggestions weren't acted upon during the Trump administration. There's an executive order that disbanded the interagency working group, and they suggested that agencies use guidance from OMB Circular A4 that was published in 2003, which were not very appropriate, but that was the guidance given at the time. The first day of the Biden administration, January 20th, 2021, there was a new executive order that Susan already mentioned that reestablished the interagency working group and indicated that we should use interim estimates of social cost of carbon, again, taken from the updated 2013 numbers, and also indicated that there'd be a process that Jay referred to where there'd be a more scientifically based update of these values coming out this year. If you saw in the news just last week, there was a 3-member panel of the Fifth Circuit Court of Appeals that issued a stay on an injunction that was issued last month from a Louisiana district judge. This injunction was ridiculous, but the 3-member panel didn't get into that. This was just a stay before the full appeal could be heard. And they ruled a stay based on standing. Standing refers to who can bring suit, when can they bring suit. There's a 3-part test: injury, causation, redressability. For injury, it has to be concrete. It has to be particularized. It can't be hypothetical. In fact, the plaintiffs in the case where the injunction was issued, they're referring to hypothetical damages in the future for use of social cost of carbon. So thankfully, the Fifth Circuit Court of Appeals issued that stay so the government can move forward with their planning and their update. Let me give you the key takeaway of my talk here today. So if you want to tune out the rest of the time, you're welcome to. The primary assumption I'm working off of is that health researchers and economists have worked in isolation for far too long. And this is the root cause of the incomplete estimates of the health impacts of climate change in these models. The solution is for economists and health researchers to better work together, coordinate together so we can improve the health portion of the social cost of greenhouse gases. Let me take you through some of our efforts to bring health researchers into this process. Right after the 2013 update, I worked with some economists to dig in and really see how health impacts were being considered in these models. I presented this research in 2014 at the International Society of Environmental Epidemiology Conference. And I got to tell you, the health researchers' response was tepid at best. Very few of them really had a lot of exposure to these types of policy issues. Virtually no one had the background to understand the economic details. Nevertheless, it was important that we start seeding the field to start bringing health researchers more into this process. We published a paper that dug in even more to these models, and I'll share some results with you in a second. And then the real reason that I believe I was invited today is to share with you a technical workshop we recently convened and a paper we published from this effort, which was an effort to update some of the health functions used in these economic models. Let me start with what we shared in 2014. This table was made since then, but it's the same information. If you look at the far left column there, the DICE 2007 model, that was what was used in 2010. The second column, DICE 2013, is what was used in the update. You can see that between 2010 and 2013, the DICE model, which was put together by William Nordhaus at Yale, he moved away from explicitly modeling these health impacts. The result of that, of the 3 models used to estimate the social cost of carbon, only one of the 3 between DICE, Fund, and Page explicitly model health impacts. And we feel like this is a critical way to think about it because it enables improvements in our understanding in health research to actually be incorporated in these economic models. Because the fund model was the only one that explicitly modeled health damages, we took a closer look at that model. Let me share with you what we found. If you look here, we divided it across 3 separate income groups around the globe, and we divided it by sector. You can see in terms of sector which ones are contributing the most to the social cost of carbon. Again, we're still using these values because it's from the 2013 update. You can see agriculture is estimated currently in the fund model to be negative in terms of social cost of carbon contribution. Energy consumption is the #1 contributor. It's likely in the update that's being worked on now that both the direction and magnitude of these sectors will likely shift quite a bit. If you look down the 5th category there, it's a little bit small, I know, but the health contribution is quite small. It's less than 10% of the total social cost of carbon numbers. This is interesting to me personally. I feel like for many of us, that health is a primary motivator for what we're suggesting for more aggressive action on the policy front. Yet in these models, the health portion is quite small. If you dig into the specific health endpoints in the fund model, it's almost entirely driven by diarrhea mortality, second by diarrhea morbidity. And it's interesting here, if you look within the diarrhea mortality endpoint, a little more than half is impacts occurring in low-income regions, and a little less than half is occurring in high-income regions, US and Europe. And this might not make sense to you at first, but really what's driving this, there's an important point here, which is in low-income countries, if you look at the counts of deaths, for example, it's much, much, much larger than we see in high-income regions. But at the same time, the value of statistical life or the economic valuation of those deaths is much lower. So this is why even though the number of deaths is much higher in the low-income regions, you can see there's a comparable contribution to the social cost of carbon because of the much higher value of statistical life in high-income regions. Again, any health researcher looking at this would say, you know, if this is what's included in social cost of carbon, we're missing some things, and this is really not the right balancing of health endpoints we know are implicated in climate change. One more thing I want to mention is we took a deep dive into socioeconomic assumptions in these models and how it changes the health portion of the social cost of carbon. We don't need to go into these details, but just know that if you adjust some of these assumptions in these economic models, income elasticity, assumptions about improvements in economic output in low-income regions, use of global equity weights, even without changing the health functions themselves, the health portion of the social cost of carbon increases dramatically. Let me share a few minutes here about the effort that we did through the American Thoracic Society to convene experts in a technical workshop to see if we can't improve the damage functions used in the health portion of the social cost of carbon. We started pitching this to federal agencies in 2019 towards the end of the Trump administration. And I got to tell you, it was the same kind of response. When you talk to health researchers, it's like pulling teeth to explain to them why this work is so critical. The opposite is true when I spoke with economists. I remember one meeting, I took a train down from New York to DC to meet with climate economists at EPA headquarters. And as soon as we mentioned to them the idea, they were enthusiastic, saying it was long overdue and it's tremendously valuable and needed. And that was a refreshing feedback compared to health researchers. A lot of the health researchers, I almost had to bank on reputation, kind of a just trust me, this is important kind of sales pitch. Thankfully, they agreed, and we were able to get some funding from EPA, CDC, and NIEHS to convene this technical workshop. We had about 28 individuals in the end who participated, mostly health researchers and some economists. We were able to hire some methodologists and some medical librarians to do a systematic review on health impacts of temperature change. Specifically for all-cause mortality, we were able to do a meta-analysis. And from this work, we were able to generate some regionally resolved estimates of the net impacts of temperature change on all-cause mortality risk. The reason these are net changes in mortality risk is increases in high temperatures lead to increased risk, but increases of low temperatures actually decreases mortality risk. So getting those net impacts taken into account are important. The other thing I'd point out here is we were explicitly looking at linear impacts of temperature. Our best understanding from the health side is, in fact, temperature impacts are nonlinear. But in order to have it better fit in with economic modeling, we intentionally looked at linear impacts. And we can talk more about in the Q&A if anyone's interested in that. The other thing that came from this technical workshop was recommendations for how these models can better incorporate health impacts. And I'm really proud of what the group was able to do in this regard. Things from recognizing we shouldn't rely on a key landmark study, but instead have many different studies providing insights into health damages. The emphasis on mortality versus morbidity impacts. One, they're easier to calculate, and two, the economic impacts are greater. Recommendations for improving the climate parameters so we can make better use of health information. And then finally, air pollution is not included in any way. Air pollution generally, and more explicitly, air pollution from wildland fires is totally absent from these economic models. So that's an area we need to work together moving forward so we can improve the health portion of the social cost of carbon. Anyway, I'll pause there. Hopefully we seeded a few ideas, and I'm looking forward to more discussion in the Q&A. Thank you. And I believe now I'm supposed to pass it on to Noah to take over for his talk. Go ahead, Noah.
Thanks, Kevin. Let me just share my screen quickly. Okay, hopefully you can all see that. Yeah, I just want to follow up with that. That was a really great introduction, so I appreciate that, Kevin. First thing I want to do is just say how pleased I am to be part of this seminar, and in particular because there's clearly a very heavy public health bent to this event. And the social cost of carbon, as the others have said, is a hugely important topic that, in my experience, also has been largely absent within public health. But that is definitely starting to shift, and this seminar is evidence of that, which is really fantastic. So I personally wasn't introduced to the concept of the social cost of carbon until my postdoc, when I began working with a team of climate economists and climate ethicists. And as I learned more about it, I would say I was probably simultaneously perplexed, frustrated, and excited. So I was perplexed, because I couldn't believe how late I was to the party. I guess that speaks to this often used quote that some of you may have heard about how the social cost of carbon is the most important number you've never heard of when it comes to climate policy. And that was certainly my experience. I was frustrated, as Dr. Cromar described a little bit, because it was so clear that the best possible evidence from environmental epidemiology and environmental economics really hadn't been used in the damage functions that was estimating the social cost of carbon, at least until recently. And there really have been enormous strides in the last 10 to 15 years, really understanding these associations between climate and weather and various health outcomes. But the reason I was excited when I learned more about the social cost of carbon was because the damage functions and the modeling frameworks used to estimate it offer a lot of potential to analyze some of the biggest questions in climate and health, either for the first time or from a new perspective. And that's what I'm going to focus on for my remaining time. So specifically, there are three big questions, or maybe I should say assumptions, within public health that can be interrogated using the damage functions that are the basis for estimating the social cost of carbon. I don't want to say that these questions can necessarily be answered definitively, but I do think it's possible to make substantial progress. And of course, there are surely more than three questions, but these are the three that I think about a lot, so that's where I'm going to focus. So the first is the idea that climate change represents the greatest public health threat of the 21st century. This language or similar language is thrown around in public health all the time, in papers and reports, in interviews. I admit that I've used it myself, including, of course, in grant proposals. And while many experts agree with this statement, I would say that for the most part, we have not demonstrated it very well, or at least not at the global level, and not compiled in a way that is systematic and comprehensive. So a state of the science damage function along the lines of what Dr. Cromar described and what Dr. Carleton will describe in a moment provides a lot of insight into exactly this type of question. It allows us to estimate how big the health impacts of climate change are likely to be. And if we want, we can compare that to other types of climate impacts or other types of public health challenges. So the second question is about how concerns for equity should affect the way society thinks about addressing climate change. So I would guess that most of us here worry not only about the total amount of harm that will result from climate change, but also about how those harms will be distributed across population. So climate impacts are disproportionately likely to harm already disadvantaged populations, which is something that concerns many of us, but there's surprisingly little research on this important topic at the global scale. Nevertheless, the research that does exist indicates that if it's true, it's likely to be a big deal for the social cost of carbon. So specifically, there are two key pieces of information that policymakers will need to begin to incorporate equity into the analyses of social cost of carbon in a robust way. The first, as I just mentioned, is how our climate damage is distributed across the population. And the second is how much more weight we should give to climate impacts that occur in disadvantaged populations. So that latter aspect is largely an ethical question that society will have to grapple with, but we as researchers can help inform that question. So to say it another way, if we consider the same climate impact to be worse if it happens in poorer compared to richer populations, and we expect that let me start that again. So to say it another way, if we consider that the same climate impact to be ethically or economically worse when it affects a poorer population compared to a richer population, and if we assume that the total amount of damage will be higher in a poorer compared to a richer population, those two facts will combine to increase the social cost of carbon. And that may happen, that may be a quite dramatic increase in the social cost of carbon. So, while the bulk of this work has focused on inequality across countries and regions, it's also extremely important to account for inequality within countries, even within high-income countries. So this plot, as an example, is taken from some work by some colleagues of mine who asked what the effect would be on the social cost of carbon if they accounted for impacts to different income quintiles within countries, as well as differences between countries. And they show that if we care about equity, the distribution of impacts matter, and it matters a lot. So the yellow line here is the social cost of carbon if climate harms fall mostly on the rich, and the blue line is the social cost of carbon if they fall mostly on the poor. And the difference, as you can see pretty clearly, can be in order of magnitude. So these are really highly stylized scenarios, and I encourage you to read the paper for the details, but I show this to make 2 points. The first is that the social cost of carbon connects strongly to issues of equity and justice, which of course are pervasive in public health. And the second is that we need to prioritize a research agenda that quantifies not only total damages, but the distribution of those damages across regions and countries, but also within them. And we are making a lot of progress on this front, but I would argue that it's one area where much more effort is needed. So the last issue I want to discuss is how damage functions can be used to investigate cost-benefit type questions that people in public health think about. So specifically, there's a literature in public health about what we refer to as the health co-benefits of mitigation. So this is the idea that if we enact policies to reduce greenhouse gas emissions, it will not only reduce climate damages, but it will also produce a near-term public health benefit, for example, by reducing air pollution. So in some places, those co-benefits themselves warrant mitigation because they alone outweigh the costs, but in other places they don't, or at least they don't without also accounting for the avoided climate damages. So if we have a damage function that allows us to account for both sides of that public health equation, it allows us to set up a modeling framework that incorporates both the climate benefits of reducing emissions as well as the public health co-benefits. And therefore, we can use that framework to ask questions about optimal mitigation policy. So for example, we can ask questions like whether the targets outlined in the Paris Agreement are economically justifiable. We can ask what is the optimal level of mitigation at the global level or at the country level. And we can ask how that depends on concerns about equity, We can also ask, what is the optimal mix of, for example, air quality policies versus climate policies, and so on and so forth. And it's really the damage function that allows us to holistically answer these sorts of questions. And we've asked several of these that I've just listed in a couple of recent studies. I don't have time to summarize the results. We can talk about it in the question and answer session, but you can find them in the papers that I've just shown here at the bottom, which I recommend highly if you are struggling with insomnia or if you enjoy self-flagellation. Now, of course, there are a few caveats to these results. One is that we certainly aren't the first or the only people to ask these questions. And another is to emphasize that we were using the older damage functions that Dr. Cromar described. So some of the quantitative results may need to be reevaluated, though I do expect that the qualitative results will hold. And we did some sensitivity analyses showing that. So with that, I will end with a few brief conclusions. The first is just to emphasize again how pleased I am that the social cost of carbon is getting more attention within public health. And we're finally starting to see modern epidemiology and econometric studies inform these damage functions. The second is just to emphasize that the importance of equity in this space, and that we still have a lot to learn about the distribution of climate impacts, but also the impacts of climate policies. And finally, I just want to say that I can imagine a suite of novel research topics that use damage functions or use the social cost of carbon or the broader modeling framework. And I hope people on this call participate in that research, and I look forward to seeing those studies in the future. So with that, I will close and pass our virtual floor to Dr. Tamma Carleton. Thank you.
Great, thank you so much. Like the other panelists, just really excited to be included on this program and really looking forward to a conversation after my brief remarks. I'm an economist by training, and so I'm excited to jump in with a bunch of public health experts and think about how my work in this space can be complementary to the work that we're seeing in the other talks. So what I want to briefly review is my work with colleagues at the Climate Impact Lab, where we are working to build data-driven estimates of the social cost of carbon. And of course, given the topic today, I'm going to focus in on our work on all-cause mortality and the role that has on the overall social cost of carbon. So we've gotten a great overview of the SCC. The only short point I want to make on this slide is that because there are these many different stages required to compute the SCC, this means that our task as researchers and as policymakers is to keep up to date and up to speed with a variety of different interdisciplinary literatures. This is really difficult, and it means that it requires really active participation of researchers with policymakers to try to keep these numbers up to date and speak to many different literatures at once. As we've been discussing, given that sort of high bar in keeping our policy relevant metric up to date, we know that currently our SCC estimates are in dire need of updating, and that the Biden administration is working actively to pursue this. So these are the three models that Kevin and Noah have been talking about, DICE, Fund, and Page, and part of our effort of the Climate Impact Lab is to work on updating these damage functions, which relate overall losses in economic welfare terms to magnitude of warming. A few sort of windows into why these damage functions need updating. These are aggregate takeaways. They also apply in a health context. First is that we're sort of missing modern economics, and I would also add to this slide epidemiology and public health research, which quantifies the economic damages from climate change. What you're seeing here on the left is a little histogram of the empirical publications that inform the damage functions in these models. You can see they're very out of date and there's not very many of them. In contrast, a recent literature review that we've done, including economic, public health, many different disciplines of research in recent years, shows us that we have this sort of treasure trove of empirical estimation of the impacts of climate change on a range of different social and economic outcomes. And all of those studies in those blue bars are currently being left out of the federal and often many states level SCCs. As was mentioned earlier, the climate models are also in need of update. In particular, the speed of warming is out of date, and this is really important when we think about the role of discounting and computing the SCC. Again, I'm following my colleagues here and highlighting equity, and and spatial resolution. So these models of spatial resolution doesn't really even allow us to say something about climate change impacts differentially within or even between countries. So our work at the Climate Impact Lab is to rethink how the SCC is calculated to solve some of these problems. And so we're going to be following some key guiding principles. We want to build SCC estimates that are based on best available empirical evidence as well as climate science. We want to include data that is globally representative, not just pulling data from places that are largely wealthy and temperate, where it's really easy to collect data on key social and economic outcomes. We want to account for adaptation. So you'll see estimates of climate relationships today in a lot of work, and we want to think about how those relationships may evolve in the future as populations adapt to a gradually changing climate. And then, as of course you can imagine, there's inherently an enormous amount of uncertainty in these calculations, and we know there's unequal impacts, and we want to be able to characterize that uncertainty and that inequality, as well as potentially value it in our final estimates of the SCC, as Noah was mentioning previously. So we've built a new integrated assessment model to try to solve these problems, and we're calling it the data-driven spatial climate impact model in order to highlight that we are sort of data forward in our modeling approach, and we're taking that spatial resolution really seriously, and you'll be seeing that in my slides. So our approach to this problem is modular. So we're going to be building estimates of the SCC in a sector-specific manner before integrating them together. Of course, for today, I'm just going to be talking about our work on mortality, and building off of some of Kevin's remarks, this is going to be all-cause mortality only. I completely agree that there are many other components of the health impacts of climate change that should and can be integrated into the SCC. We are sort of starting with the biggest, what we think is the biggest fish, and trying to tackle it really well with data and build infrastructure around SCC calculations in this space. But I completely agree that there's many other health components that need to be added to this list. But that's what we'll be talking about here. So we are taking a data forward approach. That means that this whole process begins with a comprehensive data collection effort. This is what we've compiled so far, subnational mortality records covering a little over half of the global population. These are at about county level, which is really important for thinking about that local level relationship between a changing climate and outcomes of interest. We then use a statistical model, and you don't need to pay attention to the math on this slide, but we use a statistical model that's really common both in economics and in epidemiology and public health to link changes in climate conditions to changes in the mortality rate. And as was mentioned earlier, we see in our data, just like many other people have shown in other work, that both extreme cold and extreme heat increase mortality rates, particularly for vulnerable populations. So this gives us a sense of how sensitive the population is in terms of all-cause mortality to climate today. But as I was mentioning, we know that adaptation is likely to happen in the future. So we build on this model by allowing the shape of that curve you just saw to evolve depending on given conditions in a location. In particular, for our work on mortality, we're going to think about how your average climate and your average income change your resilience or adaptation to a given weather event. So let's look at this visually instead of thinking about equations. The way this works is you can imagine going to the coldest regions of the world and thinking about what happens on a very hot day. Here you're seeing the marginal effect of a very hot day on the 65 plus age group all-cause mortality rate. And we see that in these cold places that don't experience these days very often, this is a really severe effect. So really large impact in death rate, about 15 deaths per 100,000 from a single hot day. But when we move to warmer parts of the global population, we see that this declines, reflecting the fact that these populations are more adapted to heat. They're expecting these heat days. They know what to do. They have air conditioning. They know not to go running at noon in the middle of the day. And so we're seeing this decline in the right-hand panel reflecting adaptation that we can observe in the historical record today. By the time you get to the hottest regions of the world, you see a much more muted response of a hot day on the all-cause mortality rate than you do in very cold locations today. And so we're going to use this information to inform projections of the future that account for that adaptation as we can see it in the historical record. So we're going to pull that together to build global scale projections of climate change impacts, and to speak to this need for increased characterization of the unequal impacts of climate change. We're going to be doing this at the scale of about 25,000 regions around the world to capture really important dimensions of inequality. So here's an example of what this looks like. This is our predicted estimate of the mortality sensitivity to a hot day. So this is reflecting how adapted a given population is to a hot day today for this more vulnerable age group, 65 plus. These red regions are places that are either very cold and not expecting those hot days, or they're very poor and they don't have the adaptive capacity to respond to that hot day. So these regions in sub-Saharan Africa in particular are very concerning because these are places that are likely to see a lot of hot days, but are still not very well adapted given income constraints. So this is what our model predicts today. But of course, as climate change gradually unfolds, we expect gradually warmer climates and rising income. So here we're using a variety of different socioeconomic projections of future income. And when you see this map getting lighter here in 2050, that's reflecting our estimates of increased adaptation as the century unfolds. This proceeds such that by the time you get to 2100, we see a much more muted color scheme here, reflecting the fact that populations are more adapted to those hot days by the time we get to 2100 under a high emission scenario, and there's a higher expectation of seeing those hot days more frequently. We can pull those estimates together along with projections of climate change under different emission scenarios to give an aggregate sense of the total death rate changes due to climate change. One really important finding in our model is the importance of counting for adaptation. So here you're seeing a benchmark scenario where we ignore adaptation altogether. We say that populations are just as adapted in the future as they are today. And we see really enormous impacts on mortality rate. So over 200 deaths per 100,000. And, just for comparison, in the US, I think our auto fatality rate is somewhere around 11 to 12 deaths per 100,000. These are really large effects. But if we account for the role of projected income growth in enabling populations to respond to these events, we see that these projected effects decline. And they decline even further when we account for the benefits of slowly adapting to that gradually changing climate. I'm happy to talk about the details of this calculation if people are interested, but we also try to account for the costs of adapting. You don't get to just turn on your AC for free. And so if we do project that people are doing things like increasing air conditioning to protect themselves, we want to account for the costs of that adaptation as well. And that raises this effect to somewhere around 85 deaths per 100,000 at end of century. Of course, these are highly uncertain. And so we take uncertainty really seriously here through Monte Carlo simulation. Again, happy to talk about the details if people are interested, but we think it's really important not just to convey sort of point estimates when thinking about the policy relevance of these metrics, but also to characterize all the sources of uncertainty in these estimates. So this panel is about the SCC. A lot of our work is about the SCC. That's sort of one number, but of course, what's really important here is to think about how these impacts are distributed across the world, both in terms of how you may want to change that single number, but also if you just want to be able to put alongside an SCC estimate a map displaying the distributional consequences of climate change. So here you're seeing that these effects are very differentiated across the globe, with many northern regions benefiting and many poorer, hotter regions suffering. Again, each one of these location-specific estimates is uncertain, and we want to characterize that uncertainty. That's what you're seeing with the histograms. Just to sort of summarize the importance of inequity here, echoing a lot of the comments from Noah, what we tend to see is that in our projections is that the poor are suffering much higher increases in all-cause mortality due to climate change. That's what you're seeing with these red bars for the global poor. But in contrast, we're projecting that the rich are likely to invest a lot in adaptation. And that's what you're seeing with these higher bars of adaptation here for the global rich. So today's income is a strong predictor of the distributional consequences of future climate change, both in terms of how much you may spend on adaptation versus how much you may suffer an increased health burden directly. So I know I'm running out of time. I'm going to wrap this up really quickly and say, these could give you physical damage estimates of all-cause mortality risk, but what we're all here for is to try to think about the SCC. So what we do is we turn those physical damage estimates into monetized damages using the VSL. Again, lots of different important assumptions come into play there, and I'm happy to talk about how we do that. And we index each of these simulations against the total magnitude of warming. So each one of these dots represents one simulated future scenario of the total monetized damages from climate change against the magnitude of warming. And this means that we can empirically construct a damage function that can then be used to calculate the SCC, as opposed to some of the more parametric assumption-based damage functions that are used in the earlier models. We can combine this damage function with a standard simple climate model that allows us to pulse the atmosphere with a ton of CO2. Remember, what we're after here is what are the mortality costs from increasing CO2 by 1 additional ton. So we pulse the atmosphere with a ton of CO2, that leads to a change in CO2 concentrations, a change in temperature, and then through that damage function, a time path of damages to mortality. And then, of course, we're characterizing uncertainty again by thinking both about climate uncertainty and econometric uncertainty. And so I'll just conclude here with a final slide that gives you a sense, as was sort of hinted by prior speakers, about how important it is to bring novel methods and data to bear on this question when we think about updating our existing policy metrics for the SCC. So what you're seeing on the, what you're seeing on the left is the current interim SCC estimates from the Biden administration, which again come from that 2010 IWG effort. And what you're seeing on the right is the fund model in gray, which is one of the models leading to this yellow bar. And then in blue are our sector specific estimates that update each of these sectors. And so the mortality one is really important to focus on here. We are seeing enormous impacts on all-cause mortality. Again, this is just one component of health in terms of the SCC, but we see that currently it's really dominating our estimates of the SCC, and we think it's really important to bring these new data to bear on this question, given how different these gray and blue bars are, suggesting the importance of updating our science and evidence base here. Sorry for probably going over time, but thanks so much. And I look forward to Q&A.
Thank you so much, Tamma, and all of our panelists. Really, really excellent presentations. We're going to move in now to the Q&A section. So if I could ask our panelists to please go back on video for this portion of the event here today. I am just really excited to see some novel research happening in this space. It's just so important, as we heard each panelist talk about, and this truly could be, change our path towards carbon mitigation. Is just really that important. We have a bunch of questions in the Q&A, so we will try to get to them. We have about 10 minutes left, so let me just go ahead and ask the first one, and panelists, feel free to just unmute yourself and go ahead and give some thoughts. This first question I had actually wanted to ask myself as well, so glad that it was asked by somebody else. What training and dialogue is missing in public health so that more experts are on board with modeling and monetizing impacts associated with climate change? I'm thinking that many do not have enough education or exposure to fully understand the empirical frameworks in economic research, and as a result present skepticism towards the social cost of carbon.
I can start with some comments. I think it's a great question. I think it may take a little bit of time, but time meaning not to answer the question, but for it to actually happen. The first thing I would say, and this is something that I feel strongly about, is that I do believe that all public health students should have an economics class when they're doing their MPHs. I think that's a very basic concept, but there needs to be more general economic literacy in public health schools, and that would help go a long way toward understanding some of these concepts like the social cost of carbon. And beyond that, I think we need to be intentional about it. I teach the social cost of carbon in my class. I think with some basic guidance, almost any faculty member could teach at least the basics of the social cost of carbon. And then I also think the conference circuit is a good place to do it. Kevin mentioned the fact that he presented at ISEE to sort of crickets in the room, and I've had the exact same experience presenting some social cost of carbon stuff, and I think there's really space on the conference circuit to try to intentionally have panels on the social cost of carbon, whether it's original research or summarizing the existing research, or even how to teach the concepts, because it really is an important topic, and it really is something that I think people in public health can contribute to in a meaningful way.
Great, thanks, Noah. And let me also flip this question a bit and ask about economist training. So we have a few economic models that have been developed over the years with somewhat cursory treatment of health in those models. And how do we further connect these communities and also have some health potentially some health training for economists working in this space.
Yeah, I can jump in. I am encouraged by a growth in publication in and schools in interdisciplinary science within economics. So I'm sitting in an interdisciplinary school here as an economist and have an expert in vector-borne diseases down the hall. And I think these types of schools and programs are increasing, and I think that's really exciting. But also within economics, we are publishing more in general interest science journals, which requires me as an economist to make sure I'm speaking correctly to and engaging with public health reviewers or epidemiologists as reviewers. And so I think that's an exciting area to go. But in terms of my recommendations for general economists, I work on interdisciplinary teams, and I think that's essential. Like, I don't think this work can and should be done in a disciplinary silo. And I think especially economists tend to write papers with one or two co-authors and don't really get outside their bubble very much. And I really think it's important that we do for this and many other topics.
Great, thanks so much. Let's move on to the next one. To what extent do the panelists expect the Intergovernmental Working Group's ongoing update to the social cost of carbon to bolster or improve some of the health-related functions of the metric?
I want to second what Tamma and Noah said about that answer, about how we can do better. In terms of what the update will look like, it's hard to say exactly. I think what Tamma showed at the end in terms of the different sectors and their relative contributions to the overall SCC, I think that that's probably the right distribution of impacts across sectors. I think health is going to take a huge jump forward. I think agriculture is going to move forward from what was been estimated in the past, and things like energy consumption will probably drop down a little bit. So what the precise numbers will be, a big elephant in the room, you can do your best job on these functions, but you have other variables in these models that change the final number quite dramatically. So for example, the discount rate you use will make a bigger impact than the individual health functions you use. So I think that would be my response to that. The distribution Tamma showed is probably just about right and what we should expect moving forward.
Yeah, I mean, I can try to summarize from what I expect to happen, which is essentially what Kevin said, which is I think we're going to see a vastly improved estimate of social cost of carbon where the health impacts become a much more important figure. But there's still going to be plenty of work to do beyond this update, I think is what the takeaway is going to be.
The only addition I'll make is just to remind people how this is intricately tied to other parts of regulatory frameworks at the federal level. So as Kevin just pointed out, key decisions like valuation of a statistical life and how we treat equity and how we discount are very important in forming the ultimate number. And those are decisions that have to be made in many different domains across the government. So I think there's points at which, we've got to put our best research out there, and then there are going to be policy considerations that tie across government that are harder to predict and sort of beyond the SCC itself.
So the discount rate has been raised a couple of times, and there was actually a question specifically about the discount rate because it is so important. How do discount rates figure into these calculations? There are arguments that from the perspective of future generations, discount rates should be zero. Anyone want to take a crack at explaining the role of discount rates here and sort of the range of discount rates that are considered?
We have the non-economists talk about discount rates. Though I think the one thing that's obvious is there's motivated reasoning that a lot of groups will do on this. So what can we do to make the number as big as possible? What can we do to make the number as small as possible? Obviously, as scientists, we don't subscribe to any of that nonsense. The discount rate should reflect reality as much as possible. That means a changing discount rate over time. Obviously, we value ourselves and our children more than we value our grandchildren. But as soon as you start talking about how do I value my great-great-great-grandchildren versus my great-great-great-great-grandchildren, it's probably pretty similar at that point. So I think a moving discount rate over time makes the most sense. But again, that's not fall into the trap of motivated reasoning. It should reflect reality as best as possible.
Thanks, Kevin. I'll just jump in and say, in terms of the work that I just presented and the work that we try to provide, are sort of a modular analysis that is invariant to that decision, so that policymakers and other researchers can, change the discount rate around and make their own, conduct their own calculations. The numbers I showed you use a 2% flat discount rate. I agree with Kevin that theoretically that should be a declining, or sorry, not necessarily declining, a time-changing discount rate. There are regulatory restrictions that may make that difficult, as per my prior comment. And so one of the reasons we show in our baseline scenario a constant discount rate is because that's traditionally how the government has conducted discounting. But my only additional point on this, and we're talking about trying to be objective as scientists and figuring out the discount rate, which inherently has some ethical implications, is that when you say a statement like from the perspective of future generations, discount rates should be 0, we want to be really clear that there's an objective economic argument for why there should be a positive discount rate. So if you think that future generations are likely to be richer than today, which we can debate, $1 is worth a lot more to me than it is to Jeff Bezos. And so as we project wealth to increase, we should expect that the same dollar value of damages should matter less to that wealthier person than it does to us today. So it's tied to our economic scenarios of the future, but it doesn't mean when we have a positive discount rate, we are necessarily putting a value judgment on future generations. We're trying to reflect the economic circumstances of that projected future.
Great, thank you. We only have a couple minutes left, so let me just say that we are capturing the Q&A because there's a number of really great questions in here, and we'll distribute those to the panelists, and we can actually get in touch with some of the attendees to further this conversation. So I'll just ask one last question that was asked here. What is the next step for integrating other climate and health impacts beyond mortality, like morbidities, into the social cost of carbon? And I'll just add to that, we heard a lot today about heat-related mortality. Kevin talked about the importance of air quality and other aspects, other pathways through which climate will affect health. What more do we need to know? What's the next low-hanging fruit for inclusion beyond heat mortality?
Go ahead.
Go ahead, Noah.
Well, I think there's a whole suite of impacts that work either, that don't necessarily work through changes in daily temperature, whether some of those will be things like food production impacts and vector-borne disease impacts that may be sensitive to temperature, but work on different time scales than what we've been talking about. There may be, health outcomes driven by other climate variables like precipitation rather than temperature. So I really think there's an enormous scope to continue to improve the damage functions. I think, as we've talked about throughout this panel, one of the key challenges will just be to get the people working on those issues to be able to present their results in a way that's useful for the damage functions. And Kevin talked a little bit about that at the beginning. Even within the temperature mortality literature review, it wasn't possible to use all the studies simply because of the way the results were presented or not presenting the actual exposure response functions and so on. So that's a very general answer, but I think temperature related mortality and morbidity is an enormous one, but there's so much more that should be integrated over time. And I encourage people to start working on those topics.
I'll just quickly mention a small anecdote. I was recently, there was a meeting for the WHO, the technical advisory group, and there was mentioning that they're trying hard to work on estimating morbidity impacts of air quality right now around the world. And it's almost an impossible task. And so to think about trying to do this for a number of different health endpoints over time, generations in the future, the difficulty of doing that is hard to overstate. At the same time, if you were to do it perfectly, it's likely that total economic dollar at the end is still going to be quite a bit smaller than the mortality impacts, simply how we deal with the valuation of these health endpoints. So it's a more challenging endeavor, and it's going to make up a smaller piece of the pie ultimately. So while it's important, we need to keep grinding away at it. It's okay. We shouldn't get demotivated because, ultimately it might not be quite as important as some other endpoints.
I agree with both of those comments. I just maybe to complement what Kevin just said, I think there's a benefit with this type of estimation and damage function construction for the SCC, but potentially an equally important policy relevant outcome is to characterize these sector specific, outcome specific estimates at local scale, because we all know that we are in an adaptation planning mode now. And so I think even if it doesn't form, a given vector-borne disease, for example, doesn't form a large share of the overall SCC, given how we value impacts, it could be really important for local policymakers trying to project public health system demands over coming years. So I think all the researchers interested in this space, there's both an SCC motivation, and there's also a lot of need on the adaptation planning side.
Well, I'm hearing a pretty great call to action to those researchers who are on the call to work in this space and really build up the evidence base so that the relationships between various climate impacts on our environment and the world that we live in affects our health, that those relationships can be built into the future social cost of carbon estimates. So we're past time now. I want to bring the panel to a close and just thank you so much for a really excellent conversation, very important and high impact conversation today. I hope this is just the beginning, and I'm looking forward to other avenues, other events where we can further this conversation. So thank you all very much for sharing your insights, and to our participants for asking some truly excellent questions. Thank you very much, and have a great rest of your day.